dear colleagues. First of all, I would like to thank to the organizing committee for inviting me to give a lecture in this web-based meeting. I also would like to congratulate the 25th anniversary of the Serbian Sports Medicine Association. I want to talk about the two pandemics. One is the up-to-date Covid-19 pandemic, and the other one is the pandemic we are dealing with for a long while, which is the physical inactivity pandemic. The common terminology of pandemic for both of these diseases has been expressed by World Health Organization indeed. The human organism is designed to move, as the famous painter Bruegel depicted centuries ago. But unfortunately, we are not moving enough since quite a long time. Therefore, physical inactivity pandemic is accepted as a leading cause of death in the world, which is one of the top 4 pillars of a non-communicable disease strategy. According to World Health Organization, the prevalence of physical inactivity among adult population is increasing throughout the world. As the primary consequence of this, the prevalence of obesity is also increasing. When we look at the small island countries, for example, we see that the rate of obesity is shocking in size. Because the colonizing nations sought to civilize the islanders, introducing proper food habits. So, they encouraged dependency on imported food, and local fishing and farming of the islands died out. The physical inactivity has been shown to put a great burden of diseases and decline the life expectancy. It increases the risk of many adverse health conditions, including the most common chronic diseases such as coronary heart disease, type 2 diabetes mellitus, and several cancer types. Since much of the world's population is inactive, this link presents a major public health issue as well. Worldwide, physical inactivity causes 6% of the burden of disease from coronary heart disease. 7% of type 2 diabetes mellitus, and 10% of breast cancer and 10% of colon cancer. And it causes 9% of premature mortality. In other words, more than 5 million of deaths per year are related with physical inactivity-related diseases. So we may easily conclude that physical inactivity has a major health effect worldwide. Decrease in or removal of this unhealthy behavior could improve health of the people substantially. Coming to the hot topic, COVID-19, we know that it primarily affects the lungs, causing interstitial pneumonitis and severe acute respiratory distress syndrome. It also affects multiple organs, primarily the cardiovascular system. We also have learned in a very short time that mortality is increased by comorbidities such as cardiovascular disease, hypertension, diabetes, chronic pulmonary disease, and cancer. Yes, as you have noticed, the mortality increases with the presence of chronic diseases, which are almost the same diseases closely related with physical inactivity. It's clear that the pathways of these two pandemics intersect in these diseases that increase the mortality. Let's have a look at the diseases that have close relationship with physical inactivity. Have a look at cardiorespiratory system, heart diseases, myocardial infarctions, hypertension, stroke, hemostasis problems, congestive heart failure, endothelial dysfunction, atherosclerosis, peripheral artery diseases, and deep vein thrombosis are all closely related with physical inactivity. Insulin resistance, metabolic syndrome, type 2 diabetes, obesity are endocrine system problems also related with physical inactivity. Osteoporosis, osteoarthritis, balance deficits, fracture and falls are also closely related with physical inactivity. Immune system is also adversely affected by physical inactivity. When we look at the digestive system, we can see that non-alcoholic fatty liver, colorectal cancers, diverticulitis, constipation are also related with physical inactivity. Looking at the reproduction system, you can see that breast cancer, endometrial cancer, polycystic ovary syndrome, gestational diabetes, preeclampsia, and erectile dysfunctions are also increasing with physical inactivity. Cognitive function is adversely affected by physical inactivity, and also depression and anxiety are increasing with the physical inactivity as well. Now look at skeletal muscles. You can see that physical inactivity leads to sarcopenia and disuse atrophy. If we leave the sedentary lifestyle and start regular exercises with moderate to vigorous intensity, we may reduce the relative risk of death up to 5-fold. When we look at the major cause of morbidity and mortality, and that's to say, the cardiovascular diseases, we see that physical inactivity and obesity are the most prominent risk factors. By having only one of the 5 of healthy lifestyle factors here written on the right upper corner of the slide, the relative risk of stroke decreases to half. Having all of these good habits decreases the risk up to 5-fold. I also would like to mention that having a metabolically unhealthy condition, in other words, having a sedentary lifestyle, significantly increases the risk of death. I hope we will be able to overcome Covid-19 pandemic soon and be together in the forthcoming events. I also wish we can eliminate the physical inactivity pandemic to decrease the morbidity and mortalities closely related with it. So I wish you all health and peace and hope to see you in the next anniversaries.